Hello everyone. In this session, we'll be discussing another important topic from pediatric nursing, that is breastfeeding. So let's start. Breast milk is wholesome food for the baby. Okay. It contains all the nutrients which are needed by the baby during first 6 months of life. We know, right? Because without breast milk, we should not give anything to the baby. Okay, exclusive breastfeeding for first 6 months. Then breastfeeding should be started within half an hour to 1 hour of birth as soon as possible after a normal delivery. Okay, and in case of cesarean section, breastfeeding can start within 4 hours. So in case of normal delivery, we are starting as soon as possible within 1 hour or half an hour also. But for cesarean section, 4 hours. Within 4 hours, we have to start breastfeeding. A mature sucking pattern that can adequately express milk from the breast is not present until 32 to 34 weeks of gestation. That's why preterm child face the problem for sucking, right? However, the coordination between suck and swallow and breathing is not fully achieved until 37 weeks of gestation. Fine? Hope it is clear. Then coming to the advantage or benefits of breastfeeding. So for baby, it is like breast milk rich in sugar, lactose, which split into glucose and galactose. We know, right? And sugar galactose is essential for development of brain or CNS. Okay, so what will be the point? First point, important point is galactose, which is essential for the development of brain or CNS. Then coming to the second point, IgA and lysozyme. This will be providing immunity to newborn and protect from different type of infection. So IgA and lysozyme will provide immunity to newborn and protect from different type of infection. Now coming to the lactoferrin. It will inhibit growth of E. coli bacteria and protect the child from gastroenteritis. Fine. Then lactobacillus bifidus inhibits bacterial growth and makes the stool acidic. Okay, so it will basically remove the bacterial growth from GI system. Then coming to PABA, para amino benzoic acid. It protects the baby from malaria. Then it contains low and easily digested protein like lactoalbumin, main protein and lactoglobulin instead of cow's milk. So in cow's milk, casein is present, so decrease load on kidney of the baby. Fine. So cow's milk में जो casein present है, that may load on kidney, right? So that's why human milk that doesn't contain casein, so it will decrease the load on kidney of baby. Then it contains amino acids like taurine and cysteine, which are important as neurotransmitters. So we have to mark it with another color. So what does it say? It contains amino acids like taurine and cysteine, which are important as neurotransmitter. Then fats into breast milk contain rich amount of monounsaturated fatty acid and which decrease risk of atherosclerosis and polyunsaturated fatty acid, which are essential for myelination of nervous system. So I am revising it again. Fats into breast milk, it is about rich amount of monounsaturated fatty acid that will be decreasing the risk of atherosclerosis and polyunsaturated fatty acid, which are essential for myelination of nervous system. For mother, lactation amenorrhea suppress ovulation, so exclusive breastfeeding serves as natural contraceptives for first 6 months. Okay, so it will be working as a natural contraceptive for the mother. Then it lowers the risk of ovarian and breast cancer. So this is also very important point. Help the mother to lose extra weight gain during pregnancy. So those mothers who are breastfeeding, their risk of weight gaining will be decreased. Then it reduces the chances of PPH and promotes speed of involution of uterus as well as, so this is helping to reduce the chance of PPH and promote speed of involution of uterus. It promotes emotional bonding between baby and mother, so lower risk of behavioral problem in the children. Then coming to types of breast milk, let's see. Colostrum, that is protective milk, yellow and thick milk secreted during first 3 days of delivery. So it is called colostrum, which contain high amount of antibodies, that is IgA, and fat soluble vitamin A, D, E, K. So you have to remember that. So that colostrum is rich in antibodies IgA and fat soluble vitamin A, D, E, K. Then transitional milk, milk secreted during 4 to 14 days of delivery. It is called transitional milk. So it has increased fat and sugar content. Fine. Then mature milk. What is mean by mature milk? That is thin and watery milk. Okay. And secrete after transitional milk. So this will be secreted after transitional milk. For milk, what does it say? Milk which available at starting of regular feeding. So every day when mother is breastfeeding her child, so that time which milk will come first? That is fore milk. Okay, it will be having high amount of protein, sugar, vitamin, minerals and water. It satisfies the thirst of the baby. So basically it will be satisfying the thirst of the baby. Then hind milk. What is hind milk? Milk which is available at the end of regular feeding. So first one is fore milk, that is coming beginning, right? Starting milk. And hind milk will come at end of regular feeding. So which have high amount of fat and energy. And it satisfies the hunger of baby. First, it will be satisfying the thirst. Then second one, it is satisfying the hunger of the baby. Then preterm milk. So milk secreted after preterm delivery, it contains high amount of protein, sodium, iron, immunoglobulin and calories. Okay. Then physiology of lactation. Prolactin reflex or milk secretion reflex, that is sucking up the nipple by baby. Then it will stimulate the hypothalamus by afferent nerve. Then prolactin will be released from anterior pituitary. Then milk secretion by alveolar epithelial cells, that is called acini cells of breast. Then milk secretion or production. Then oxytocin reflex, how it will work? Or let down reflex or milk ejection reflex. So 3 names they may ask in question. So crying of baby or mother's emotion and attention to the baby. Then stimulation of hypothalamus by afferent neuron. Then increased secretion of oxytocin by posterior pituitary gland. Okay. Then it will contract the myoepithelial cells around the alveoli of breast. Then milk ejection into lactiferous sinuses and ducts. This is the physiology of lactation. Then suppression of lactation, how it happens? Bromocriptine, that is 2.5 mg orally BD for 2 weeks. So bromocriptine increases the secretion of dopamine, also called prolactin inhibiting hormone, and dopamine inhibits secretion of prolactin. Due to inhibition of prolactin, suppression of lactation occurs. So when it will be used? Though in those cases when the baby has been died, right? That time that suppression of lactation is to be done. Then weaning. Gradually introduction of semi-solid food after 6 months or slowly tapering of baby from breastfeeding called weaning. Okay. So after 6 months of exclusive breastfeeding, we are introducing semi-solid food to the baby. So that is basically called weaning. Iron stores are depleted at 4 months of age. Okay, so whatever iron baby has got from the mother, that will start depleting from 4 months. So breastfeeding infant should give liquid iron supplementation after 4 months. Okay, at 12 months, egg white part can be given and cheese may use at place of meat. So we are not giving meat, we can use rather cheese. Not feed by honey till age of 12 months, because honey may cause botulism. That is a severe condition of diarrhea, right? GI irritation and many things associated with botulism can be seen. Then avoid solid food that may cause choking in infant. Example like nuts, foods with seeds, then raisins, popcorn and grapes. All these food should be avoided. Then sequence of adding solid foods are iron fortified rice cereals, then fruits, vegetables, then meat. Okay, this we can use. Artificial feeding, what are they? Feeding of infant by preparation other than human milk is called artificial feeding, which is also called bottle feeding. Okay. Then composition of human and cow's milk, gram per 100 ml milk. So let's see. In human milk, fat is 3.8, protein is 1.2, lactose is 7, calcium is 35 mg, water is 88 gram, and energy is 65 kilocalorie. So every first 3 in gram. So 3.8 gram fat, 1.2 gram protein, 7 gram lactose, 35 milligram calcium, 88 gram water, then 65 kilocalorie energy. Then in cow, if you compare 4 gram fat, then protein is 3.4 gram, then lactose is 4.4 gram, then calcium is 120 milligram, then 87 gram is water, then and energy will be more, that is 67 kilocalorie. In buffalo milk, 6.5 gram will be fat, 4.3 gram will be protein, 5.1 gram is lactose, then 210 calcium, then 81 gram water, and 117 is energy, 117 kilocalorie. Then problems in breastfeeding, that is inverted nipple, retracted nipple, third nipple, flat nipple or short nipple. So all these problems can be arised in case of breastfeeding. Then contraindication of breastfeeding. Let's see. In maternal, there is divided into temporary and permanent. So let's see, in temporary cases, that is acute puerperal illness, then cracked nipple, this will be the temporary things, and permanent organic heart lesion, then active pulmonary tuberculosis, puerperal psychosis, then high doses of anti-epileptic and anti-thyroid drugs. In neonatal, in temporary part, that is very low birth weight baby, asphyxia, and in permanent part, that is severe degree of cleft palate and galactosemia. Now coming to what is called galactosemia. It is an autosomal recessive disorder marked by an inability to metabolize galactose. That first point we have studied, na, galactose, it is helping in CNS and neuron, that part. Okay, sugar present into the human milk because of congenital absence of one of 2 enzymes needed to convert galactose to glucose. Okay, now care during cracked nipple, that is expose the nipple for 10 to 20 minutes after feeding to ear. Okay, rotate the position of the baby each feeding, then ensure that baby is latched on the areola, not on the nipple. So colostrum can express after feeding as a moisturizer to prevent cracking or drying of nipple. Okay, then avoid use of soap on breast because it may remove natural oil or lubricant, then which increase chances of cracked nipple. So we should not use soap because it will remove the natural oil. Then care of breast or nipple, then maintain general hygiene and wash the breast once daily. So we have to wash simply with a normal water. If breast engorgement, feed frequently, apply warm packs before feeding, apply ice packs between feeding, and massage the breast. Use well-fitted bra with breast pad in the bra to absorb any, if any, milk leakage is there. Then we have to assess latch achieved by newborn, that is audible swallowing. We will be able to hear the swallowing. Then type of nipple, then comfort of mother, hold or position of baby, then score to evaluate the effectiveness of early breastfeeding. Okay, that is numeric score also. 0, 1, 2 is assigned to 5 letters of acronym. Lower scores less than 5 can indicate the need for assistance for better success of breastfeeding. BFHI, so baby friendly hospital initiative, or BFHI. BFHI launched by UNICEF and WHO in 1992 to promote breastfeeding worldwide. Okay, and it contains following 10 steps, that is, every institute should have a written breastfeeding policy. Okay, then trained nurse or trained staff to implement this policy. Okay, then inform all pregnant mothers about the benefits of breastfeeding, then help the mother to start breastfeeding within half an hour of delivery, then explain the breastfeeding techniques, which will be best techniques, then no foods or drinks other than breastfeeding. Next is encourage the practice of rooming in, encourage breastfeeding on demand, no artificial teat for babies, then foster the establishment of breastfeeding support group and inform the mother about it. Then any hospital who is following all these points, then they will be called baby friendly hospital. Okay, all these 10 steps should be followed. So revising once again, that every institute should have a written breastfeeding policy which will be pasted or available in the particular area, then trained staff to implement this. Okay, now we have a policy, right? But if we don't have trained staff, then how will we implement this? So we should have trained staff to implement this policy. Then we have to inform all pregnant mothers about the benefits of breastfeeding, and in pregnant state only we'll be informing about this. Then help the mothers to start breastfeeding within half an hour of delivery. Okay, we will assist also. Then next is explain the best techniques of breastfeeding. Okay, then no food or drinks other than breastfeeding we have to teach the mother, because in rural area basically they will give, there is a myth like to give honey to the baby, but that is not the hygienic, right? Because it may cause botulism, we have already studied. So that thing we have to teach the mother, and encourage the practice of rooming in. What is rooming in? Rooming in means we are allowing mother and child to stay together. That is basically meant by rooming in. That will help that infant to relieve from stranger anxiety or separation anxiety as well, and also the mother and child relationship. Okay, then encourage breastfeeding on demand. Whenever baby needs, then we should give breastfeeding. That is the meaning of this line. Then no artificial teat to the babies, no artificial feeding will be given. Then foster the establishment of breastfeeding support group and inform the mother about it. Okay, so that's all. Hope all the points about breastfeeding is clear to all of you. Hope it helps, and see you in next video. Thank you.